So this is something that's a little bit different, but I wanted to do something behind the scenes of what you would expect to happen behind the scenes in therapy. So if anyone has any questions about what it's like to be in therapy or to know what goes on behind the scenes in therapy, then just let me know. Hi guys. So if you want to ask any questions about behind the scenes, I'm trying to kind of demystify what it's like to be in therapy really. So first of all, it's having a therapy space. If you're able to do therapy in person, then it is obviously great to have a therapy space. I personally love having a lot of what they call plants. So I've got this massive monstera, which is my baby. It's actually older than me. So having a nice setting obviously is important as you can get it really, and it's about creating that space where someone feels comfortable to talk to you and to be able to go through things that are quite difficult. Then I think really just being able to come into a room that's quite calm and tranquil. I try and have something that smells good. So I have a lot of essential oils. I'm learning more about that, but trying to kind of make sure that the room is, as I said, as tranquil as possible. One of the things that I would often do before a client comes in is to prepare. So within CBT, that could be about looking at the model of the therapy that you're going to use and being able to work through that. So I've got a question: what book is good to read for CBT? As you can see, I've got quite a lot of books here. Mind Over Mood. This one is a really good beginner's book for CBT. So you can get this one, and there is another book that goes with it that has all the worksheets. So it's a really great beginner's book just to get you started. It works through all the basic CBT techniques and teaches more about CBT. So that is a really good book for beginners in CBT. I'm trying to see if there is any other ones over there. I'd say that is probably the best one to start with. There are some, if you want to look at something that is more specific, so there'll be some, I've got some about intrusive thoughts, about just like a pure O, so if you just got the pure O, so just having the intrusive thoughts, this is a really good book, Overcoming Unwanted Intrusive Thoughts. But really it's about thinking about what kind of book what do you want out of that CBT book and being able to work through that. So as I said, when someone comes for CBT, it would be about me thinking about what model I'm going to use. I will generally always have obviously your notepad just to scribble stuff down. And remember that when you're in therapy with a therapist, that you can ask to see what they're writing down. It's not a secret. I'm not kind of writing anything down there that I wouldn't want you to see. It's really to just capture what we're talking about, and so that I've got a good, clear record of what was discussed. And as I said, with CBT, it would be that the following week we would maybe go back to some of the things that have happened before. So I'd be able to say, okay, well on this day we spoke about this, and I always encourage my clients to make their own notes. So they can bring their own notepad. Obviously they don't have to show me theirs, but so they have then a record of what was discussed, any kind of key learning points, anything that was those light bulb moments, like, aha, yeah, I really want to remember that. To get them to write it down. And then another thing is kind of all the models. That's a really basic CBT model. So looking at your thoughts, behaviours and feelings, and then looking at then how I would want to change those things. So I would always take about, it depends, 15 minutes or more to prepare for each client before I see them. And that would be something that I would then, at the beginning in CBT, we set an agenda together. And I would say, okay, these are the things that I've prepared. And then talking about anything else that they would like to add to the agenda, then we would write down the agenda on that piece of paper and we would work through it. It may be that we allocate times to the things on the agenda. So it may be that we would say, okay, well, let's spend 5 minutes on a check-in, let's do 10 minutes for homework, maybe another 10 minutes on something else, and you would break down the 50-minute session so you were able to then be able to work through everything that anyone wanted to get through in therapy. So they would be the kind of things I would do between the session and how we would start the session. Another thing with CBT is that you would have homework. You would have things that you would want to do between the sessions. And if you don't have homework or things, then it's really not CBT. So you need to make sure that you are having tasks or activities to do between the sessions. And I will also prepare them before. There may be some times where you start the sessions and the homework may change slightly. So again, I have got loads of, you can't see that, loads of things there, loads of folders that have so much different techniques and exercises that you can use. The Arthur Freeman CBT book, I'm not sure about that book, but if you found it helpful, then I think that's the main thing. There are so many different CBT books around. It's just kind of finding one that speaks to you and one that makes sense. So they will kind of be so the main books. And then in terms of, as I said, the other things behind the scenes at the moment, obviously all the kind of hand wipes, gel, everything like that, just to kind of make sure things are as safe as possible. And they would be, kind of the main key things. If there's anyone that wants to know anything else behind the scenes, then as I said, just jump in the comments. And I think that I just want to be able to demystify therapy, because I think people think that therapy is a bit of an unknown entity, that you don't really know what's going to happen or what's going to go on. But as I said, the transparency between yourself and the therapist is key. Anything that they are, as I said, if they're writing down anything, you can also see that. All the notes obviously are kept in a locked filing cabinet that I'm the only one that has the key. Same kind of with confidentiality on a laptop. You would do things that you would kind of be able to then, like, you can send all the emails, everything's so secure. But they're kind of the main things that I would say for people to do. So you kind of see meditation and yoga, obviously they're key. And like with therapy, it's not just that you would come into the room and that would be it. There would be a lot of things that you would maybe do in addition to therapy. So whether that is the kind of the meditation, whether that is yoga, where it's anything that else that would make you feel good about yourself and being able to work through a lot of the difficulties. So techniques to stop reoccurring. Okay, so that was what the book was. I can see what someone else is writing, and that's up to an individual, what you want to get out of it. If that's kind of what you choose to do, then that's fine. Reoccurring negative thoughts, again, that is something that is key in CBT. So we look at challenging your negative thoughts, whether that is through, it will take me too long to find one of the sheets at the moment, but there's something called a thought record within CBT. So you look at what your negative thought is, you then look at what is the evidence for and against that negative thought. So if your negative thought was, I'm really stupid, then you'd really look at, okay, so what is the evidence for that negative thought being true? Do you have anything that proves that you are stupid, however you define stupid? And then you look at the evidence against that, and then you try and come up with another, maybe a balanced alternative thought. And when I get people to think of alternative thoughts, I often get them to think, okay, if your friend was saying that to you, what would you say to your friend? What would you say to them? Would you say, oh yeah, you are stupid? Or would you try and maybe come up with something else, an alternative thought that would make them feel less critical, less negative? So that is really, how you can challenge the negative thoughts. The intrusive thought book that I mentioned, that would be, you could use that for negative thoughts, but that is really when you're looking at more of the intrusive thoughts, which we all have. Intrusive thoughts are completely normal. But it's obviously when they bother us to the point that it's really distressing, where it would be where you would look into doing it. Stress management and techniques other than yoga and meditation would be great. One of the things I've done a video on this before about your stress jug. So the idea that everyone is able to live with a certain amount of stress. So if you kind of imagine that or if this was like Thor with water, that you would have a certain amount of stress that you can manage with, but then if you're not doing things to manage your stress, then it will be that will be when your jug would overflow. So other stress management techniques would be challenging kind of those stressful thoughts, looking at kind of what's on your plate, what is causing you the stress, and can you make any changes to those things. So thinking about things quite practically, and thinking about if it's to do with the amount of time that you have and you feel that you don't have enough time for things, then it could be about looking at your day and being able to manage what you're doing within your day. So whether that is breaking down your day into chunks, or kind of breaking down your week. And I think being able to understand time management can be really helpful when we're looking at stress management. And if we're finding that we are procrastinating because of how we are feeling, when we feel stressed, we often procrastinate because things get too much and it's just like, oh, I don't know what to do, so you don't do anything. So using the Pomodoro technique, which is where you work for 20 minutes, then you pause for 5, and then you work for another 20 minutes, that can be really key for stress management. So hopefully that's kind of giving you more things to think about rather than just, as I said, the yoga and meditation. So thinking about what's on your plate, looking at your time management, being able to overcome procrastination, and then just being aware of what are your triggers when you're becoming overwhelmed or stressed, and being able to think about your stress jug and be able to work with that. There was someone, what's the name of the book? So it's Overcoming Unwanted Intrusive Thoughts. It is by Sally Winston and Martin Seif. So that is for a CBT based guide to getting over frightening, obsessive or disturbing thoughts. The other book that I mentioned was the Mind Over Mood. So again, they're really, I said this is a more generic CBT book, whereas the other one's for more intrusive thoughts. So this is Mind Over Mood, Changing How You Feel by Changing the Way You Think. It's by Dennis Greenberger and Christine Podesky. So yeah, that's the name of those books. Do you let the client think, or you help them towards intrusive thoughts? I think that's a really good question. It will be about helping those clients really understand what they are thinking. If they are going to start to challenge their their negative thoughts, we would do that together. So it would feel really like a team. And I think that's something, again, in therapy, behind the scenes thinking, that you need to be like in a team with your therapist. So being able to work through things together. So I wouldn't just tell them, just think positive thoughts, or really just give them the answers. It'll be about working through their negative thoughts and thinking about what positive thoughts or what more alternative or balanced thoughts could you have. It's not just about positive thoughts, because that might feel really overwhelming for some people. So it may be about, something that is more alternative or more balanced, I think can be really helpful, rather than, just think positive thoughts. So hopefully that answered that question. What would you say those books helped with imposter syndrome? Imposter syndrome is something that a lot of people experience. I experienced it myself. The Mind Over Mood, definitely there is some thought records in there and thought challenging exercises that could really help with imposter syndrome. I did a post on imposter syndrome, I think, last week, and I've got some more techniques on there, so check that out and see what you think. But with imposter syndrome, it is about challenging your thoughts, because our thoughts trick us into thinking that we haven't got the skills, we're not qualified enough, or we don't know anything. So it would be really about checking in with those negative thoughts and being able to balance them out. So getting the evidence is really, really key when we have imposter syndrome, because we normally discount any sort of positive evidence that proves that our imposter syndrome thoughts aren't, or that they aren't correct. So we would often, say, if you had achieved a massive just something really, really good in the week, and then your imposter syndrome will be like, oh, that doesn't really matter, or that's not that good, anyone could do that. So it would be really challenging that and being able to work through those imposter syndrome thoughts and being able to recognise them. When I've spoken about negative thoughts in general, the key is to recognise them. And that can sometimes be just sitting quietly with your thoughts and noticing what thoughts come up. Sometimes if I'm feeling like stressed or overwhelmed, or I can feel a strong emotion in me, but I can't really understand where it's coming from, I might set a timer for a couple of minutes and write down every thought that's coming into my head, almost like you can call it like a brain dump. So you're just dumping everything that comes out. And sometimes that can be enough to kind of get out your imposter syndrome thoughts, your negative thoughts. And then when you've got them written down on paper, you can think more rationally about them. Thinking about, if I said these thoughts to a friend about myself, what would they say to me? Or if a friend said that to me, what advice would I give back to them? So yeah, being able to really work through that. I hope so. I kind of went over a few in those questions. Mind Over Mood has worksheets also in the book. Yeah, so this is the, I don't know, I think this is a therapist book. So there's a therapist book and a client book. But this has got worksheets in it. You can see that there. But I think the client one has more worksheets, but if you like to really understand all the theory behind it as well, you could get the therapist one, but the client one still has all the theory behind it as well. So yeah, it's for both of those. So someone said, yeah, that book is, so it's for both the therapist and the client. Then I had another question, no worries, about the stress management. Glad that makes sense. Any tips to build self-esteem? So again, if we're talking books, where is it? So Fennel is kind of one of the CBT queens for low self-esteem. Stuff just fell down. This one, Overcoming Self-Esteem. So this is a self-help guide using CBT techniques. It's really, really good for building self-esteem. I don't think it's that expensive either. But again, with low self-esteem, you want to look, and this is quite similar actually to imposter syndrome, because you would want to look at the things that are holding you back. What is that narrative that you're saying in your head? And as well as, I've spoken a lot about thought challenging, obviously, on this live, but again, challenging those thoughts would be really good. That's the Overcoming Low Self-Esteem, if that's the book that you're looking at. And so with Overcoming Low Self-Esteem, you would really want to be looking at, again, challenging your thoughts, but also what you are not doing. Often when we have self-esteem, we predict certain things. So it will be about, what am I predicting that's going to happen? So it may be that we don't ask people questions because we predict that what their response will be. So within that, you would look at all the things that you predict are going to happen, and then you look at setting up behavioural experiments that will help you to challenge what you are predicting. And with low self-esteem, we have predictions, but you also have precautions. So say if you felt your negative thought was, they're not going to want to help me. So your prediction would be that if you asked anyone to support you, that they are either going to downplay your request for help, or they're just not going to help you. And then the precaution that you would maybe take would be just not to ask them. So within that, we would want to look at challenging that thought, but also pushing through and doing the things that we are avoiding doing. So whether it's avoiding asking people for help, whether it's maybe not sending an email because we think about a certain response, and being able to break that down into the things that we would find most distressing, or the things that kind of really activate that low self-esteem, and being able to work through those areas. So it could be emailing someone, it could be asking someone for help, and you really you start at the things that are most easy to do and you work your way up. And that can work for imposter syndrome as well. So as I said, we make predictions, and then we behave in a precursive way. We do precautions to make the predictions not come true. But because we don't try, and we don't see if the predictions are going to come true or not going to come true, then it makes the low self-esteem still stay there. We're not challenging to really see that we can overcome the low self-esteem. So yeah, low self-esteem, we're thinking about the negative thoughts we have, the predictions and the precautions, and working through them. But as I said, that book is a really, really good book as well. Okay, so I've got through all the questions there. Hopefully this has kind of went off a bit on a tangent. So it's meant to be behind the scenes in therapy. But obviously I wanted to kind of answer the questions that you guys come up with. So yeah, if you liked CBT, CBT for OCD is, and the NICE guidelines recommend it. And I've seen so many clients, whether it is OCD with kind of following through with compulsions, or just, as I said, the pure OCD, that CBT can be super effective for both. You're welcome. So I will leave you here, guys. If you like this kind of just chatty video, or you want more behind the scenes, I said I've kind of shown you around the therapy room. A clock as well is something always good to have in therapy, and have that clock so you and the client can see it. Yeah, hopefully that was helpful. There's nothing else in the room apart from, I said, all the plants. So I hope you guys have a lovely day. Thank you for tuning in with this. And yeah, I will speak to you guys soon. All right, take care. Bye.